the other side of the room. The doctor, the mechanician, and you should become integrated to let us see if it works. Okay, so please, yeah.
Thanks. Thank you, Francesco, for inviting me to make this talk today. You may have guessed that I am going to try to answer some of the questions that were asked in the previous presentation, which are not so easy. So what we have done in the past 10 years in Strasbourg is work a lot on bone remodeling problems, and you may have understood that the bone remodeling problem is very complex because bone has a complicated structure inside at different scales, okay, and it involves some solid mechanics but also some fluid mechanics solving, but not only from the mechanical point of view, because the bone remodeling also involves the biology, which means you need to take account of the distribution of cells, the movement of cells, the nourishment of the cells, etc., so they can act inside the bone structure for the bone remodeling. And we have been working a lot on that in the last few years, and mainly on like bone degradation, for example, for osteoporosis predictions, or for eventually bone density loss in space, microgravity, for example. And today I'm going to focus more on the application that we have seen just in the previous presentation, which is also the modeling. And we want to try to link experiments, clinical data, and numerical model. This work is a collaboration with different persons. The data I'm going to present you today, Yves Bolender, who is an orthodontist at the Faculty of Dental Surgery in Strasbourg, and Majid Baniasadi, who is associate professor at the University of Tehran, who worked with us on the bone remodeling problem, Yves Raymond, who is a colleague of mine in Strasbourg here, and myself. Dr. Hervé Petit for the biological parts in B3 laboratory in Paris, Pascal Hurt for the characterization of the wires, and two PhD students, Delphine Wagner and Camille Spinga. Okay, just to sum up a little bit on the problem that we have seen previously, we want to aim at correcting the dental malocclusion using a combination of brackets which are fixed onto the teeth and wires which are located inside the brackets. And the problem is quite difficult because the whole system of the 14 teeth is in self-equilibrium, okay? Everything moves together, and you have to find a way to adjust that in such a way that you can align the teeth in a precise way, accounting not only from the mechanics but also from the biology. Since the whole arc is a difficult problem to solve, we initially decided to start on a simpler problem, which is 3 teeth, okay, that you see here. We suppose that the other teeth are aligned and there's only one that is misplaced compared to the other ones. So we fix our brackets and then we put the wire onto the brackets and we try to realign these teeth, knowing that the force induces biological effects onto the PDL, leading to bone formation on the one side, which is under tension, and bone resorption on the other side, which is under compression. Okay. We had 5 objectives. First one is to quantify the forces and moments applied by the arch wire onto write the mechanical equilibrium in 3D space, develop some experimental characterizations to quantify the applied forces and moments, and provide a finite element model which we would like to be predictive for the tooth displacement and accounting for the bone remodeling to optimize the procedures. Okay. The difficulty is to understand exactly, precisely, what is the tooth movement inside the bone, okay? I want to start with a very simple definition, which is what we call here the center of resistance, which is located somewhere in the root of the tooth, okay? And the definition of this point is so that when you apply a linear uniaxial, punctual uniaxial force at that point, the tooth moves in a linear way, okay, inside the bone. Which means, obviously, when you apply some equipment on the top of the tooth, if you want to have a linear displacement of the tooth, you cannot do it with a simple uniaxial force, okay? You need to apply a combination of force and moments on top of the tooth so that it moves linearly, okay? So the force to moment ratio defines the type of displacement you will obtain in the bone remodeling problem. The difficulty is to anticipate the values of the force and the moment in order to have the adequate tooth displacement. And this is the role of the orthodontist and the expertise he has in making this anticipation, also knowing that you need to apply a certain amount of force intensity to be within the physiological range. If you're out of this physiological range, either you have nothing or you have tissue necrosis and degradation and necrosis. Okay, initially all the orthodontic activity was based on some simple approach on two teeth that you see here. You have some simple mechanical equilibrium developed by Burstone and Koenig in 1974, and most of the classical orthodontic procedures have been based on this simple equilibrium. Lately, in the last few years, a number of experiments and numerical models have been developed, also that you have seen here in the previous presentation, some tools that you can just put on the teeth in order to try to realign them, okay? But all these works are, I want to say, globally phenomenological in the way that we observe some evolutions, okay? But we have very limited information about what happens at the local scale. And this is what we are interested in. What happens in 3D at the level of full dental arch, but we have a limited quantitative data, so we want to investigate the real biophysics which is driving the tooth movement. Okay. Obviously, the problem here is not to look into complicated theory, so we have a very simple approach to this problem because the problem is already complicated, that we have seen previously in the presentation. So we still deal with the three-tooth problem. We have one which is misaligned compared to the two others, and we will pull the wire here vertically in order to realign the tooth with the two others. So when we do that, we write the equilibrium of forces and moments on a simple geometry. We apply the displacement here, which obviously generates a pulling force into the wire.
Contact between.
And inside the brackets, depending on the number of brackets that we have and the wire inside the bracket, we will have some friction force inside the brackets, okay, which is represented here by this FR force. And then by the application of the applied force here on the wire, we have some reaction forces here on the bracket, from the bracket to the wire. As long as the force that we apply is small, okay, we have a static equilibrium, okay, and we can write this static equilibrium over three teeth. When you increase the force, okay, you increase the displacement into the central tooth, okay, the bracket will slide on the two sides because you pull more, okay, in the central part. And what happens is that this equilibrium here is going to be disturbed by this wire sliding inside the brackets. So the equilibrium that you have at the beginning, which drives the bone remodeling due to the elasticity of the wire, okay, is disturbed because you lose the elastic recovery because of this wire sliding inside the bracket. Okay? So, what we did was to write the classical simple static equilibrium for this problem in terms of forces and moments. So the sum of forces equals 0, sum of moments equals 0. And when we isolate the wire compared to the external system, we have this equilibrium where the applied force plus the friction force is equal to the reaction force from the bracket. Very simple. We can write it in terms of force equilibrium, we can write it in terms of moment equilibrium, okay? So therefore, when we have this information, we are able to quantify somehow the forces and moments which are developed onto the teeth at a given time, okay? Onto the brackets. But the problem is that as I said, when we increase the force in the center, we increase the displacement, we have wire sliding, which means the equilibrium is disturbed. Therefore, we need to quantify this wire sliding in order to be able to rewrite properly the equilibrium on the three teeth. So we did that, and we did it on, here you see the picture that we have a curved support, and we also did it on flat support where we glued some brackets on them, and then we put the wire inside the brackets, and then we pull the wire, okay, inside the brackets. So when we did that, here you have on the horizontal axis you have displacement, okay, and here on the vertical axis you have the friction force. So when you have one bracket, you have roughly friction force. When you have three brackets on the support, you have 3.5 newtons and 6 newtons for the flat and curved support. And as you increase the number of brackets, obviously the friction force is increasing that you would expect. And when you plot that friction force as a number of brackets, you obtain this kind of curve evolution, d'accord? Okay. So we are somehow able to quantify this friction force within the bracket. This is one parameter that impacts the elastic response of the wire to input the force onto the bracket. There is another parameter which is also important, which is the deformation of the wire. These wires, actually in this study we worked on nickel titanium alloys, which are super elastic. You see here the constitutive law of this material, and the yield stress of this material is roughly 400 megapascals. When we did a final element model of the problem we have to deal with, we put the wire inside the bracket, and then we apply displacement in a central bracket, and then we look at the stress distribution inside the wire. And what we see in terms of stress distribution is that for small displacement, 0.5 and 1 millimeter, the stress distribution inside the wire remains under the yield stress. Therefore, we have a complete elastic recovery that drives the tooth displacement during the treatment. However, when we increase this displacement to higher values, above 2 or 2.5 millimeter, very quickly we see some stresses which are above the yield stress, which means that for large displacement treatment, it means that you do not have the complete elastic recovery that drives the tooth displacement through the bone remodeling. So you have a combination between, on the one side, the choice of the wire, the size, the material, etc., the quantity of displacement that you need to apply because the tooth is far away, okay, and the friction, the wire sliding through the brackets, and the material's behavior. So all that is a little bit complicated to deal with. But eventually, I was going to say a simple case where we are not outside of the range of working, we were able to quantify using this static equilibrium the forces and moments that were applied onto the teeth by the wire. Okay. Once we are here, we have the input, which is already quite good. We're happy to have the input. But then we want to know how the tooth moves inside the bone, okay? So we need to look at the other part of the work, which is the numerical simulation and bone remodeling. As Michele said before, one of the main driving parameter of the tooth movement for orthodontic treatment is the PDL, periodontal ligament, okay, and how it behaves, how the biology of the PDL responds to the mechanical load, okay. And the difficulty of the PDL is that we have very little information on this PDL. We know roughly its composition, we know it displays a nonlinear viscoelastic behavior, but biological response, very, very limited information. So, we made some assumptions that the vascularization is distributed in volume in a homogeneous way inside the PDL. When we apply some mechanical force, we have deformation, okay? And this deformation leads to a blood flow variation inside the vascularization. And then when we have blood flow variation, we have also some oxygen and glucose concentration changes. This is important. Why it's important? Because oxygen and sugar are the main, how should I say that? The main parameter, what is needed by the cell to survive, to live, okay? If they have no sugar, no glucose, no oxygen, the cell die, basically, okay? So you need to have an input. So they are driving parameters that we look at. So the question is there a link between PDL oxygen concentration and orthodontic bone remodeling? So we looked into the literature to see if there was a link, and we were fortunate enough to find two publications by Arnett and Otting in 2003 and 2006, who stated they did some experiments, and these experiments show that when there is a volume ligament vascularization change during orthodontic treatment, in hypoxia, meaning less oxygen, the density of osteoclasts increases, whereas the number of osteoblasts decreases. Osteoblasts are the construction of the bone. Osteoclasts are the resorption of the bone. So if you change the density of both of these cells, you go either one way or the other way. Okay? So we made three hypotheses. The first one is action of osteocyte is considered negligible. Why? Because osteocytes are located in the bone, far away from the PDL. There's no osteocyte in the PDL. And the intensity of the force that we apply is very small, so the osteocyte does not see the force that we apply. Second hypothesis, cells present within the PDL are only cells present within the PDL are active, because that's where we have the deformation, and this is where we're interested in, which means that the bone remodeling will be mainly at the bone PDL interface. And third hypothesis, the influence of oxygen on cell is the only parameter taken into consideration in this study, which may not be true, but at least we have some information. So, when we did that, we could plot the oxygen concentration as a function of volume variation inside the PDL. Okay, we suppose that it was linear in terms of volume variation, varying between two thresholds, delta V min, delta V max. Okay, and because of that, we were able to relate the oxygen concentration to the applied force. How? Well, we used, again, the two papers I have showed you just before, and we extracted the oxygen concentration as a function of the cellular density. Then we did some experimental observations onto PDL around teeth on different samples and different patients, and we were able to quantify the density of cells inside the PDL. Therefore, we were able to link the density of cell as a function of the applied force, and within the range that we are interested in, which is the orthodontic force range, okay, we see that the cellular densities vary almost in a linear way. Okay? Okay, so now we have almost everything. We implemented that into a model that we developed using the three hypotheses that I have explained before. So first we have orthodontic load onto the tooth. Okay, we link this orthodontic load to the PDL strain, deformation, volume variation, okay, which means that we have tooth movement inside the socket using some standard solid mechanics, okay. Then we have a change in oxygen concentration, which is the publication I have just showed you before, due to the volume variation, and cell multiplication depending on the oxygen variation. After that, we detect onto the final element model, we detect the elements which are at the interface between the PDL and the bone, okay, because this is where we will locate the bone remodeling problem. And then we run some bone remodeling analysis, which is dependent on the mechanical energy and some cellular activation inside the PDL. Okay. Therefore, because we have bone remodeling, we have a change of the mechanical properties. When the mechanical properties change, the tooth can move. Okay. And then we iterate this analysis a number of times, and when you iteratively run this analysis, you can see the tooth displacement as a function of time. Okay, we implemented that, and look at an analysis that we did, I would say validation analysis, okay, just to see what happens. So we work on a very simple example, which you see here, the geometry. We apply a force on the side of the tooth, which is in white here, and the bone is in blue, and we have the PDL, which is here at the interface between the tooth and the bone. The root length is 12 mm, the tooth diameter is 5 mm, and the PDL thickness is 200 microns. And we apply a force of 1.5 newtons. When we run this analysis, the first step is to look at the PDL volume change, because that is what is driving the phenomena. Okay? When we look at the volume change as a function of time, here I have plotted you 4 different times through the analysis. This is the initial condition where we have compression here and tension on this side. We have a diminution of volume on the right here and increase of volume on the left here. And because the force is on top of the tooth will tilt. Okay, it does not move in a linear way, it tilts. Okay, and we see the evolution here as a function of time for the volume. We obviously have a corresponding oxygen variation as a function of time at different places of the ligament. Just to come back to one comment that was made previously, here the distribution is kind of homogeneous because the geometry is perfect. Obviously, if you work on a real teeth, on a real tooth, the geometry will not be perfect. So in some places you have more compression, in some other places you have less compression. Therefore, the distribution will not be homogeneous. That's fairly obvious. Okay, and then when we have oxygen variation, then we have osteoblast and osteoclast density variation as a function of time that you can see here for both cases. And then eventually, when you look at the bone density variation, you see that there is an evolution of constant bone thickness on the initial condition towards a degradation on the bone here on the right top, and degradation here of the bone on the bottom left because of the tilt of the tooth inside the socket. And when we plot the tooth displacement as a function of time, we have a jump here of the displacement, which is when the force is applied onto the structure. And eventually, after a limited amount of time, the tooth starts to move due to the bone remodeling algorithm that we implemented into the model. Okay, so in conclusion, if we look at the 5 objectives that we set at the beginning regarding the quantification of forces and writing the mechanical equilibrium, that has been partly done on 3 teeth because it was kind of a simple problem, but obviously we want to do it on a whole 14 teeth arc. And this is not completely trivial. For developing the experimentation to quantify the forces and moments, it's also been partly done. We want to do it for different wire types, different materials, different sizes, different configurations, etc. Okay? Use the finite element model. It's also partly done because although the model seems to kind of work, it is still a simple bone remodeling algorithm, and it needs to be more detailed into what happens at the local scale. Okay? And finally, optimize the procedure for orthodontic therapy. That has not been done yet. So in perspective, provide proper mechanical equilibrium, develop some more experimental characterization, improve the bone remodeling model, and try to predict the tooth movement in different cases. Thank you for your attention.